Hello there, my friends, and welcome back to another episode of the Hybrid Lab. Today, we're coming back in hot with another female physiology topic. I know that I just renamed my podcast to the Hybrid Lab, but a lot of the stuff that I'm currently refreshing on, digging into literature on, reviewing on is just literature related to menopause and female physiology. And so I know that here in this community, you guys are looking for that information as well. Mixed with hybrid training is the most effective evidence-based way to train if we're thinking about metabolic health, long-term health, and or honestly exercise for menopause, women across the lifespan, all the things. And I know a large subset of my audience here are predominantly women looking for this information. So have no fear. We're going to definitely be mixing in plenty of other hybrid specific things, but this has just been on top of mind recently, and it's easier to get it out when that is on top of mind. So if you're tuning in over on the podcast on your favorite streaming service, this is your reminder that rating, reviewing, subscribing, all those things really helps. And if you're listening over on YouTube, leave me a comment here below telling me something you learned, ask me a question, liking and subscribing to my channel always helps as well. And thank you again for being here. So for those of you who are new, I am Dr. Alyssa Olenick. I PhDs in exercise physiology, and I have my dissertation training was in the menstrual cycle effects on exercise training, performance, metabolism. And then I continued my postdoctoral work in the area of menopause, metabolism, and health. So I want to talk to you today about a topic that's really important in the space and can seem really controversial and confusing. And that is building better bones. So exercise strategies for improving bone mineral density and or maintaining it, especially in women as we age in the postmenopausal period. So I do have more notes. Again, I am trying to be better on these bigger dive-in topics to have notes here. So if you see me reading on my computer screen while you're watching, that is why, to make sure that I keep myself on topic here today. So, when we think about the transition of menopause, it does bring a lot of potentially quote unquote unwelcome changes, frustrating changes. And one of the biggest risk factors or things that we see that this is this accelerated loss of bone density or bone mineral density that can lead to osteoporosis, and increased risk for fractures and or falls, things like that. So we do have muscle loss that starts to decline as early as our 30s and is more rapidly declined as we age. Everyone sees this. We see this with everyone. That is a compounding issue for menopause. But one of the most important things that often gets left out of the conversation until it becomes something that people worry about is bone density. So that is what we're going to be talking about here today. If you want more context and information about some of the other exercise guidance and advice I have for metabolism, body composition, and or muscle, go listen to my podcast / watch my YouTube video on exercise training for menopause. I go into that a little bit more. Today will be just specifically on bone. So when it comes to bone loss or risk of bone loss or fracture risk and osteoporosis, the good news is exercise has consistently been shown to be one of the most effective strategizings for maintaining or even improving bone health during this critical period of time. So I do want to preface this, with if you were listening to this podcast episode and you are someone who's in their 20s or 30s or early 40s, like the sooner you start, the better. We do typically start to, peak our bone mineral density gain in our teens and 20s up to 30s. And then that can start to maintain or decline if we don't continue to maintain that. And so this is a really important reason for teenage girls or young women or women in their premenopausal years to also focus on this. This information is not just for oh my gosh, I'm menopausal now, I'm postmenopause, I'm freaking out, now I need to implement these strategies. No, these are strategies that everyone should be implementing across their entire lifespan. And a lot of the guidance I'm going to be giving you here today will apply to you as well, or is honestly, you will see it heavily in alignment with the way that I suggest most people train, especially women in general. So today we'll be exploring loosely the current scientific literature on exercise for bone density. Specifically, you will often hear me talk about focusing on the hip and spine. These are the areas that are the most vulnerable to fractures in postmenopausal women, the highest risk factor of that. So if you do something like a DEXA scan, which is commonly the way for assessing this in most people, is going to, you can get specific scans for the lower spine, as well as the hips. And I've done that, and or analyzed these. They're really easy, to kind of get the information of. I highly recommend people get, DEXA scans for bone mineral density, especially women. It doesn't hurt to have them when you're younger. It can help you kind of get a baseline of where you're at, or see where you are at, specifically if you are worried about this as you are aging. And so we're going to talk about, the most vulnerable to fractures and or bone loss are going to be postmenopausal women. That rapid loss of estrogen is a big risk factor there as well. And then why it's important for things like jumping, plyometrics, and load-bearing training, resistance training of varying intensities, all this stuff are important for maintaining and develop these with touches of nuance, as you guys know. Unfortunately, there's a lot of gaps in this literature right now. There isn't, this super broad, sweeping, conclusive evidence of like, oh, this is the exact perfect protocol. There's a lot of variance. They call it heterogeneity. Being dyslexic and a scientist does not bode well for me, but here we are. There's a lot of different protocols that are being done in the literature. So it's hard to find like congruent, this and this works kind of thing versus general suggestions of what you should do or directions we can go in or kind of implications and assumptions of application we can make for you when applying this to your own training. So before we dive in deeper, I do want to mention that while exercise is powerful, I am biased to my queen exercise. It does work best with a comprehensive approach that also includes proper nutrition, making sure we're getting adequate calcium, vitamin D, magnesium, things like that from our diet, or supplementation if necessary, needed, or advised, with the caveat of don't necessarily just willy-nilly take calcium supplement unless that you're working with a doctor. We don't want to like overly supplement that. But making sure that, you're talking to a nutritionist, an RD, a healthcare provider with figuring out those things for you, as well as potentially when we think about women going through peri and or postmenopausal period, the loss of estrogen is a big risk factor here. And some people, you can exercise as much as you want and you might still have bone loss or risk with that. So making sure that you are having an active advocating for yourself conversation with a healthcare provider of potentially medications that are meant to help reduce or aid in bone loss or bone preservation, and or medical hormone replacement therapy potentially can be a first line of defense for bone because of the loss of estrogen. It's a little bit more of a clear-cut story than that with like muscle isn't as clear-cut as like, yes, muscle is absolutely directionally 100% caused by loss of estrogen. That narrative's a little bit more murky, and the aging component itself makes it harder to see like these distinct clear patterns, where we do see it a little bit more clearly with bone loss. But again, not medical advice. I'm not an endocrinologist. I'm not an OB/GYN. Please talk to your medical providers, advocate for yourself, and or have those discussions with them. I'm just kind of adding that as a little bit of caveat here that, very fit, healthy women sometimes still experience this just due to bad luck or individual differences. And that doesn't mean that there's anything wrong with you, but I am here to talk to you about exercise, which is my specialty here today. So let's start by diving in a little bit more to what happens to our bones during menopause. Specifically throughout our lives, our bones are constantly remodeling. They're kind of breaking down old bone and building new bone, just like a lot of things in our body do, until, like I said, roughly, getting out of our teens into our 20s, about 30 is when we see for most of us, most things start to go downhill. If we don't continue to train, maintain, or do the things that help us preserve or stress or stimulate our body to maintain these things, just like muscle, bone is pretty similar here. And so we build more bone than we lose while we're growing up, building our bodies, kind of formulating our basic skeleton in our teens and early 20s and things like that. But as we get older, you start to lose more bone than we gain if we don't do things to continue to stress, maintain that, or support it. So when we think about during perimenopause and especially after during menopause, this imbalance appears to accelerate more rapidly because of the loss of a decline of the primary female sex hormone, estrogen, which plays a really, really crucial role in bone formation and or preventing the breakdown of bone tissue. And so when this drops, we start to see that the bone breakdown starts to outpace formation a little bit more rapidly. And so that leads to this overall net loss of bone density. And this does happen really rapidly in the years immediately after or surrounding menopause, where we see potentially women losing, up to maybe 20% of their bone density. And so that's why this period of time is so critical for intervention and or why we want to make sure that if women aren't doing these exercise training protocols or nutrition or lifestyle behavioral things that can support overall health before they go into menopause, we kind of intervene there. And I think that's where, honestly, just a side note, a lot of this confusion of like menopause specific training protocols come from, is that we see that this period of time of peri overlapping with like the first few years post-menopause is really important for interventions. A side note is there's some interesting data on, aerobic training being really important for preservation of vascular health and vascular function when it's done like in that perimenopausal period, and it being more like efficacious than post-menopause. So like this is a really important time to intervene, but it's never too early to do it beforehand, and it's never like too late to do it after. So I don't want you guys to think like, well, I'm 10 years post-menopause, like none of this is like, it doesn't matter, I should just be sedentary for the rest of my life. Like absolutely do not take that approach into what I'm saying here today, but it's important to just understand the risks and timeframes of that. And then after this kind of like rapid decline in bone loss, it does start to plateau and or decline at a slower rate. But there's, the risk factor coming into this that a lot of women don't do progressive strength training, plyometric training, jump training, which we'll unpack a little bit here later today. They didn't do sport. They spent their whole life dieting, chronic eating, under eating, rapid weight loss, not doing strength training paired with that, inadequate nutrition, and potentially are going into these periods of time with lower bone density to begin with. So that is an issue as well. And that's why I'm really reiterating like this is just not a peri and postmenopausal women issue. This isn't everybody who's planning on aging at any point in time in their life issue, especially women. So as I mentioned in my intro here, bone density is typically measured using a DEXA scan. That's the body composition scan that a lot of people will use, and it does give you bone density, which is important, and it gives you something called a T-score. And so this score basically compares your bone density to that of like a quote unquote like healthy standard. Depending on the database that your DEXA analysis is using, will dictate who it's comparing it to, what the baseline is, like a healthy younger individual, or a lot of these will have databases that will compare to the averages of different racial demographics and or age demographics and where people fall within that. But typically you will have a T-score that is considered normal, low bone mass, or osteoporosis. And I don't want to give you guys anything for like scoring yourself and testing yourself. Like make sure that if you get a DEXA and you are categorized based off your risk factor, for this, to talk to a medical provider. But essentially a T-score above -1 is considered normal. Between -1 and -2.5 indicates a low bone mass. And then below it is below -2.5 indicates osteoporosis potentially. Again, this is not medical advice. Talk to a medical provider if you are concerned with this. And again, reiterating that the primary areas concerned are the lower back and the hip regions, particularly something called the femoral neck, which is essentially where your femur bone is. It's like this neck of it where your bone and the ball is here. There's this neck right there of that ball to the long shaft of your femur that you will specifically get analyzed with a DEXA scan and you get a hip scan. They are very prone to bone mineral density loss or fractures. And so if you guys have listened to me talk on any of the interviews I've done related to menopause or my menopause and exercise thing, you guys will often hear me saying that like women should load their hips and spines. And that is why. It's not just because I think everyone should be training for the biggest booty on earth, which honestly, if women are doing one thing right in the fitness space, it's that. Because you know what they're doing? They're loading their hips and spines. So I never hate on it because at least it's doing the thing that we know is a big risk factor here. But that is why you will frequently hear me or have heard me say that in the past. So let's dive in a little bit more on exercise interventions around this and talk about the different avenues of this. And I really want you guys to recognize that I'm going to try to do this delicately with like some nuance, because there's a lot of absolutism statements that go around the fitness industry that leave a lot of women who have never done this type of training before feeling really defeated and held back because they're like, well, heavy lifting is scary to me. I've never even lifted anything in my life. Like, is heavy lifting my only option? Do I have to be doing these intensive protocols? Like, what if I'm unable to? What if I'm not prepared for that yet? What if I'm not ready for that? So I really want to go into this with like recognizing that like this is the data of what we see. And I'll give you some general guidance as we move on here to like apply this to you and potentially some nuances and caveats around this as well. So you don't feel one, doom and gloom, or two, like if you're not training like an elite power lifter, then you're failing yourself. So, let's first talk about impact loading and plyometric exercises. So I'm a really, really, really big fan of plyometrics. So jumping, hops, skips, landing, bounding, any of that type of stuff for all people, but especially as we age. I think a lot of the fitness industry loves to talk about loss of muscle and how loss of muscle is this big issue as we age. And it is a big issue. I'm not downplaying that, but I think we don't often talk enough about the loss of power. and power and force generation within muscle, but also the importance of this type of training for stimulating and stressing bone density as well, especially when we think about menopausal women or anyone who's going to age at any point in time. So not only is, impact, power, plyometric, jumping, skipping, hopping, anything that's like reactionary in nature really good for maintaining power and force output in our muscles, but also it's really great at stimulating our bones. So jumping and other high impact exercise creates this force that stimulates bone formation. And when we look at some recent systematic reviews and meta-analyses, they consistently show that high impact exercises are effective for at least improving, if not maintaining, bone density in both the spine and hip and postmenopausal women. So we do see this trend of higher intensity exercise, but higher intensity exercise often including or that has programs that include resistance training and load-bearing plyometric type exercise all in one, tend to have some of the better effects that we see on bone density here. And again, the caveat, a lot of these protocols are different. They all look different, but we do see this trend of either the plyometric loading itself and or jumping exercises, reactionary force reaction type landing things mixed with resistance training or on their own do seem to have a positive effect on bone here. So that is an important thing that I think everyone should be including in their training program. So the research indicates that jump training interventions can actually potentially reverse age-related bone loss, which is significant because we typically expect some degree of bone loss with aging for men and women. All people at some point in time will experience this, or it's a normal thing that we do see with aging alone. And so we find that some of these studies, like one of them specifically looked at jumping protocols, found that these exercises produce small but significant increases in bone mineral density. Usually these are around 0.5 to 1.5%. And so this might not seem like a lot of it, about roughly 1% of increase when we're looking at some of these trials. But even a 1% increase in spine bone mineral density has been associated with an 8% reduction in fracture risk in women and postmenopausal women with osteoporosis. So bone is not something that is really easy to see improvements within the short time. A lot of the trials where we're seeing improvements in them are typically at least 6 months, if not 6, 8, a year. And so these are things that where you're going to be looking at longer term effects in improving with this. But it's small but clinical or meaningfully significant, which can matter here as well. And we're probably not going to all max out and have elite bone densities overnight, but we can look at little improvements in these over time. So we do see this with these higher intensity type protocols or combined protocols. And so what makes jumping so effective? So research essentially suggests that the height and force of jumps matter more than necessarily repetition. So, something like, landing where it's a high impact. So whether you're landing from dropping down from a box or a bar, some of these protocols do like jumping chin ups to dropping down the ground, or they're called depth drops where you're coming from a box of a height down to the floor. That is like you're catching the impact of your body weight. That's a greater force than your body weight itself. And so we usually want something like 4x your body's impact. Or when we're thinking about true plyometric exercises where you're jumping and rebounding, every single time you're landing, you're not only taking and absorbing that force of impact into the ground, but then you're reacting to elicit that force back up. And so when we see this, you're thinking about the force of this, not necessarily just repetitions, but we do see studies with protocols involving like 10 to 20 jumps per session, 2-3 times a week with rest between jump days. And some of these protocols are as simple as just doing like pogo hops or single leg hops or little double foot hops, and then increasing them for height over time, as far as like doing like literally jumping up to chin up bar, dropping down on the floor type thing. And so this it's something though that like requires a big disclaimer here that we don't want to just tell women to go do the most high intense, hardest, highest impact thing right off the bat if they are not trained for it. I think this is where a lot of the scientific communication around this population goes wrong. It's saying everybody should be doing HIIT, jumping, and heavy weightlifting. And like a lot of people in this population haven't done those things at all. So we do want to make sure that you are meeting yourself where you're at and easing into this, or you're meeting yourself or your clients where they're at and easing them into this. So we do see pretty safe outcomes with this, not a ton of risk factor for injury, fracture risk, and or anything like that with these protocols or trials. But a lot of them are using women that already have a relatively healthy baseline, or they are supervised exercise protocols, or they have like a a few of the studies use these 8-month protocols, and they didn't, jump people into these high intense, high effort, heavy lifting or jumping things right off the bat. They instead had them kind of ease into it the first month or two before they ramped up the intensity of these things. So making sure that we are easing in and gradually increasing that. So you might do like a low impact jumping. So instead of doing like really big hops or skips or depth drops, you're doing like tiny, like skipping or tiny little bit of hops, like the short distance hops or skips or pogo hops or single leg hops or whatever that looks like at first. Maybe some jump squats before we work into, more moderate to higher impact or more advanced plyometrics jumps. And that itself probably deserves another episode on its own. It's like unpacking plyometrics and progressing that a little bit more. But you might even just start with like stepping, like hard steps, or things like that, instead of just jumping right into these big things. And I always recommend people who are worried about that, if they have low bone density or osteoporosis, talking to either your doctor about what they advise for you to start, and recognizing that not all doctors have a lot of exercise training here as well. And so I really encourage people, if you are unsure where to start, starting with an exercise training program that is specifically designed to gradually increase that over time is going to be really, really vital. You can work in person with a personal trainer. A strength and conditioning specialist is going to be my recommendation. Not all personal trainers are created equal, but if you can find like a really good gym that can help you with that, that's amazing. Or if you are newer to exercise training, our foundations training program in the Lyss method is 9 months long. And over the course of that 9 months, it gradually increases your exposure to higher intensity weight training, as well as gradually builds up your exposure to plyometrics and jumping exercise in a systematic and gradual way. For all people, doesn't just have to be menopause. Before you move into like a program like we have, lifestyle, perform, build, race, all these programs that have plyometrics, jumping, or power moves in it that are a little bit more moderate to advanced as you progress in those programs. But that's a great feeder way, and we have that option here for you. And if you're interested in that and learning more, you can always reach out to our coaches at the Lyss Method to see what program is right for you. But if not, finding an in-person person or a virtual person who can help you ease into that is really, really important. And or coaches listening to this is making sure that like you're not just tossing people in, just because we know that this is important and good and or does appear to have clinically meaningful improvements on bone density, does not mean we are taking, I don't know, Rachel Smith, who's 56 and 6 years post-menopause, who hasn't been physically active in sport or anything other than walking since she was 18, and having her do multiple depth jumps or box jumps to max height, right? Like, let's be smart and ease people in, start with steps in lower grade hops, and then progress that gradually over time to more advanced versions of these exercises. So next, moving on, load-bearing exercises. So weight-bearing aerobic activities and exercise where your bones and muscles work against gravity. So really it's that force of gravity is what we're really thinking about with improving bone. While your feet and legs are carrying your weight, such as walking, hiking, stair climbing, running, dancing, tennis, pickleball, all of these things are great. And so in general, weight-bearing activities, show that you might have a little bit improvements on bone density potentially, but it's not going to be the same benefit as some of these higher impact, higher intensity activities. And so they typically just don't have enough stimulus to increase bone density. So although being active generally across the board is really important, these things are important. I'm not saying not to do these things. I'm pro hiking. I am pro stair climbing. I love a good walk. I think that being active in general sports or dancing or whatever that looks like, especially for postmenopausal women, is really important. We have tons of data backing the utility of HIIT and team sports and or general aerobic exercise for so many things. It's not that these things are bad. It's just typically they don't provide enough of a stimulus on your bone to increase bone density. It may help maintain it or not decrease it, but it should be used for other health benefits. But potentially, if you are doing these things, if you want to make them more challenging, so potentially like walking uphill or running instead of walking, or stair climbing where it's more impact because you're having to walk up, or uneven terrain, or potentially the newest trend of adding a weighted vest, although the data on that doesn't impress me enough to think it's worth it, but potentially may have a slightly added benefit if you like it. It's not hurting anything. These might be okay things to add to make this. But the data is either lacking on how to progress these over time to improve bone, or doesn't show that it has as good of an impact as exercises that are more load bearing in nature, such as resistance training, which we'll talk about here in a second, or impact loading and plyometrics. And so while these things are great, and I add this disclaimer of like, I know that these are the activities that a lot of women are more traditionally participating in, but they're typically not going to be enough load bearing on the bone. And so, we'll talk about resistance training here in a second. You guys don't all have to become elite powerlifters, but let's do something that loads us a little bit more, or increase the intensity of these at the least, for overall metabolic health and muscle health and aerobic function. If we're unable to do these other things, and we'll give some disclaimers on resistance training here in a second. So next, this brings us to resistance training, the tried and true, the bread and butter, the foundation of life and health and longevity, it seems. At least that's how it's painted in the media and in the industry, which there's a lot of truth to that. I'm very pro muscle, I'm very pro lifting. So this brings us to resistance training, which has some of the strongest evidence for improving bone health and muscle health in general in postmenopausal women, and again, women across the board. So let's kind of break down some of the nuances here about the difference of the intensities in resistance training, because that's where I think a lot of this gets confusing or scary for a lot of people. So when we think about the current evidence, it does tend to lean towards suggesting that moderate intensity resistance training or high intensity resistance training appears to have a greater effect size or be more significant, or most of the trials honestly are looking at moderate intensity lifting. We only have like 2 or 3 trials that have looked at higher intensity lifting compared to that of like lower intensity lifting. So when we think about this, we have the most data for like moderate intensity, which is essentially, when you think about moderate intensity, we're thinking of like maybe 60 to 70, 60 to 80% of your 1 rep max level effort to, like a 7, 8, 9, 10 out of 10 effort, that classic, maybe if you think about it in the classic sense, like that hypertrophy range. Obviously the spectrum of strength versus hypertrophy has a lot of overlap, and hypertrophy can be achieved across like 1 to 30 reps, as long as you're going to close enough to proximity of failure and gaining, enough volume through that within training. But the point is here, a lot of those studies are looking at more of that moderate effect. And the reason I want to point that out is that, one, most of the stuff we have looks at that. Most of that appears to, at least if it doesn't improve it, at least maintain it. There's some messy studies where they show that bone sometimes goes down in these trials versus up. But the overall average effect, when we look at this, does appear to help. The biggest thing is with this is that it just has to be making sure that it's taken to a high enough intensity. That's kind of true for all lifting across the board, is it's not this magical rep range or set range for most things. It's that it's just taking to a high enough intensity. And so, current evidence suggests that potentially moderate intensity resistance training performed 3 days per week is effective for improving bone mineral density in the lumbar spine, so lower back, femoral neck, so the neck of that femur, or your hip areas in postmenopausal women. And again, this advantage is in trials that are lasting usually 6 months to a year. And sometimes we just don't know how long these benefits go on for, if they keep, gaining persistently, if there's a plateau, if they're maintaining. Most of these trials aren't that much longer, or we do have some following up to 24 months that we do see this maintenance in people who continue this training, and or people who fall off obviously don't continue to progress in the same degree that people who continue to train. So we also have, when it comes to these specific resistance training protocols, research indicates that like high load, low repetition, or this moderate load training is potentially more effective than this low, high repetition training for bone density. So in practical terms, this means that it's probably better to lift heavier in that 1 to 8 or 8 to 12 rep range to an adequate effort level. So a 7, 8, 9 out of 10 effort, or 1 to 4 reps shy of what failure looks like for you, rather than like very light weights for potentially 15 to 20, 20 to 30 reps. There is some caveats here that, we don't really know if these things take into adequate failure, or if we had protocols that were a little bit better in these studies that compare them to high load, high intensity training, if we might have some of the similar benefits. My general advice is that for women across the board, if you're lifting within 1 to 30 reps, and taking that within 1 to 4 reps shy of failure, and you're compiling that or pairing that together with some sort of jumping impact plyometric training, you are doing a lot of the right things, and you don't need to beat yourself up that you're not like 1 rep maxing in the gym right away or starting where you are at. But I do think that it is advantageous to train potentially in that 1 to 8 or 8 to 12-ish range for a lot of benefits, especially because a lot of people struggle with going close enough to failure with enough weight in those higher rep ranges. It's really easy for people to just kind of go through the motions there. And again, any loading is better than no loading. I really want to reiterate this. I'm not trying to shame any type of exercise, but if you are going to be doing high repetitions because you're training at home, you're training with band, you're just getting started, and making sure that we're taking that closer to that proximity of failure. If you can within that range. Once you get above that 20, 25, 30 reps, we start to see diminishing returns there for muscle strength and hypertrophy anyway. So really trying to making sure that you're in that sweet spot of that range of, less than 30 reps for what you're doing. But we see benefits across the spectrum, but it isn't necessarily bad advice to say into that higher load, lower rep, 80% of your 1 rep max effort versus, potentially also benefits of that more moderate load, that classic hypertrophy 8 to 12 range that people like to call that. Again, I say that in quotes if you're not looking on YouTube because that has kind of been debunked. You can have hypertrophy across a large spectrum of things. But it's not bad to lift lighter and more reps if it is still within the proximity to failure. So that's kind of my disclaimer there of there's a lot of way to skin a cat here. But we do have evidence that shows the peak load or how heavy the weight is does appear to be important for stress and stimulating bone formation. And we do see increased bone formation in greater than 80% of our 1 rep max in a few of the trials that we do have that are higher intensity resistance training. So we do know that in general, in mice and humans, we see this in both clinical and human trials and animal trials, that bones respond to the magnitude of loading necessarily than potentially the loading cycles or reps or volume, all that stuff. So we want to think about not just doing resistance training just to resistance train, but also having that higher load or higher impact together. So high intensity resistance exercise or moderate intensity exercise, resistance exercise combined with higher impact training. So our jumps, our bounds, our skips, our plyometrics, that type of training, drop jumps, things like that does show particularly good results in the studies that we do have that to combine them. And we see significant improvements in exercises, in these trials like deadlifts, overhead press, back squats combined with impact and jumps. The biggest caveat to add to this though is that these trials that, particularly 2 of them that looked at this in higher intensity, high load training, you'll see a lot of people quote these and saying 5x5 at 80% of your 1 rep max and these compound exercises is better than anything else. And we do see in these studies that it is effective for increasing bone mineral density and bone mass. But the things that they were compared to, the one was an at-home, very low loaded, body weight loaded, underloaded resistance training protocol where they were doing lunges and calf raises with very light weights. And the other protocol that did this combined high intensity resistance exercise was plyometrics exercise, essentially had it compared to people doing Pilates, right? And it showed that was more effective than that low load, high repetition, lower impact type training. But we don't have these trials yet that show high load versus moderate or high load versus the same exercises done at lower load, high repetitions. We just can't say that yet. Right now, we don't have that data, but we can say that high impact, high intensity, high load does work. It does work. We do see that it works. We do see that moderate load does work. We cannot say totally that the lower load, high rev stuff doesn't work if taken to failure, isn't loaded heavy enough, is still taking that magnitude of that effort compared to potentially yes, true resistance training or plyometric training is probably going to be better or more advantageous for this than maybe your Pilates, your yoga, your lower weight bearing exercises that aren't taken to a high enough intensity or close to your proximity of failure. I do feel confident and comfortable saying that. So I'm giving you guys a lot of disclaimers because I'm trying to be very delicate on a subject that kind of gets bastardized in the fitness industry. But high intensity weightlifting works. Moderate intensity weightlifting works. So that means greater than 80% of your 1 rep max, low reps, high load. That does work. I think if you're willing to do that, that is a fantastic and great and thing that I really suggest that you do. Moderate intensity lifting works. So your more classic, what you guys might think of as hypertrophy range. Again, that's been debunked, but I'm just speaking to what people are familiar with, that 8 to 12 reps taken to, again, an effort close to proximity of failure. So within 1 to 4 reps shy of failure. Those types of exercise routines are going to be very advantageous for people who are willing or able to do some sort of true resistance training. But if we are dealing with populations of people who have not been exercising at all, they haven't been training at all, or you're an individual listen to this and you feel intimidated by that, lower load stuff or lighter load stuff or higher rep stuff, whether that's banded or body weight starting from home or the comfort of what you're able to do in the gym, does not make it a waste of time. Those are going to benefit your bone density and your muscle mass and your health by starting where you're at and doing what you can. All things will improve this to some degree. The magnitude might be less, but it's not hurting you by doing that, right? And so start with where you're at, or the clients that you are working at are at, progress them where you can go or you're willing to go. But every woman does not have to do a 1 rep max style training in order to improve this, but it is worth training hard and heavy if they are willing to do it, or more moderately within, again, loading it and keeping it a higher quality effort. And if you're going to do light weights and high reps, making sure that you are still taking that to a hard effort. Again, 7, 8, or 9 out of 10 when you're done doing it is a great place to start or be. So start with where you're at, meet your clients where they're at, work people up to where they need to go. But it does appear that the most effective combination of training right now is a mix of, moderate to high load resistance training with impact, jump, plyometric, reactivity-based training for this in this population. And I think in general, those are beneficial ways to train for aging across the board, for all people, for building bone and muscle and supporting these things across the lifespan. But all lifting is good lifting. And the great news about plyometric or impact stuff is that can be done from home or a space with minimal equipment, just making sure that we're meeting people where we're at and not just making them do really high intense things that their bodies aren't adapted to and trained for yet off the bat. So I gave a lot of limitations and nuance in this already as it is, but we'll go into this a little bit more. I have a section saying let's talk about nuance, because I'm really big on that. So while the evidence for exercising is encouraging, it is really important to understand the limitations of research in general and who they apply to and all that stuff. So again, there's a lot of heterogeneity between these trials, which makes it really, really hard to compare results. So there's a lot of variability in methods, including differences in the exercise type, the settings, the intensity, the duration, the frequency, how long the trial went for, participant characteristics. So this is just kind of a general summarization of what we're seeing from this. And then my general practical advice for you of what I think is probably the best to take from this. And so this variation does make it hard to determine a specific dose of exercise needed for optimal bone health. And it also, we need to make the consideration that someone's, again, I talked about this a little bit in the beginning, but bone status at baseline can impact these outcomes. Menopausal status, is someone early menopausal, just starting perimenopause? Are they late postmenopausal? They've been postmenopausal for a decade. And the supervision level of these training protocols. It's going to be very different. People doing supervised exercise versus not. And the prescription of it in the trials does matter. So that's why I gave the caveats of okay, these trials do show this does help, but what they're comparing it to maybe doesn't support the statements people are saying, taking away from that as well. So, and again, we lack studies that really go beyond 2 years. Most of them are 6, 8, 12, maybe up to 18 months. We just don't know the long-term effects of this at this point in time. My hunches are that the more you do it, the better it is going to be, or at least maintaining it after it plateaus at some point in time. But that doesn't mean that you should just do it for 6 to 8 months and then never do it again. This is something that all people should maintain as we age. We should be doing power training, resistance training, general physical activity as much as we can tolerate and are able to do and fit into our life across our lifespan. And again, we know exercise adherence is difficult. We know people already struggle to exercise to begin with. So making sure that you're meeting people where they're at and or encouraging people that you're working with, your clients or yourself, to talk to other health professionals like dietitians, qualified nutritionists, and or doctors about potentially medication and hormone therapies that can support these. Again, not medical advice, not my guidance. I'm telling you to seek outward that support or help, because we do see those do potentially help with this as well, beyond what exercise can do or in conjunction with exercise training. And we don't have a ton of knowledge on people in very old populations, so 75 plus, which we just don't know how this is impacting this later in life. But from what we do see in most aging studies beyond just menopausal studies, because again, there's a big overlap between menopause and aging. And I know people hate when people say that, but it is the truth. There's a huge overlap, the Venn diagram of when all these things that happen are overlapping at the same time. So it's really hard to tease those apart to just know how this is going to impact things later in life. But it does sound like, for most people, the advice that I'm giving you here today is going to be something that we really would like to implement with people across the lifespan for as much as we possibly can. So with all this information, like what is the practical takeaway? How should you exercise, improve your bone health, before, during, after menopause, some evidence-based recommendations. And again, I really do encourage you to go dive into my podcast episode or YouTube video on exercise training for menopause, because I talk about this stuff a little bit more. So moderate to high intensity resistance exercise at least 2 days per week, up to 3. You can do 4. I think for most general, regular, everyday people, 2, 3, up to 4 days a week of resistance training is sufficient, and you can do a lot within that. And I don't think we need like these 6-day weekly splits, and like that's our goal or what we'd like to do. I think that allows time for other activities that we know are important for aerobic health or just living your life. So 2, 3, maybe up to 4 days a week, focusing on 2 to 3 sets of, somewhere between 1 to 8 or 8 to 12 repetitions, aiming to working at least, or, upwards of 60 to 80 or 80+% of our 1 repetition max. So fairly heavy weights, thinking about taking these within these rep ranges of 1 to 8 or 8 to 12 to within 1 to 4 reps shy of failure, or something that feels like a 7, 8, or 9 out of 10 effort. Focus on your major muscle groups with emphasis on your hips, spine, and lower body, and obviously progressively overload, gradually increasing the weight, the reps, the sets, the load, something over time. You can do more in many different ways. It doesn't always have to be weight. It can be more sets. It can be more volume. It can be more reps. You typically over time, weight will increase. Even if you are doing more reps, the load should increase as you get stronger within that over time. Even if you aren't doing like super, super heavy barbell type training, you can use barbells, you can use dumbbells, you can use kettlebells, you can use bands, you can use body weight, you can use machines. All of these are great. Use the tools that you have available for you and that you're comfortable with, or that you're willing and able to do. I'm thinking about doing some sort of impact exercise. So again, jumping, plyometrics, landing, bounding, skipping, all these things. They'd be on the same or different days of resistance training. I think for time's sake, for a lot of people, it makes sense to include these in as part of your resistance training routine. You put them before you're lifting, or you can do them on their own day. And so these protocols are really variable. So that, again, I think deserves its own podcast episode to talk more about that, of what an impact means or a jump means, because typically it's suggesting 2-ish to 3-ish days per week. Can be on the same, again, or different days of resistance training, 50 to 100 impacts per session, or 5 sets of 10 to 20 jumps. But this is going to look really, really different, because something like 3x5 depth jumps into rebound jumping is going to be a very different load and impact than maybe like 2 to 3 sets of just 10 pogo hops that are done to short height. So we really just want to make sure that we're gradually building up and exposing people to where they're at. But we're thinking about impact of the jumps and then number of jumps per session. So I would start people with lower, like 2 to 3 sets of 10 jumps of like double leg jumps for like pogo hopping or skipping, and then progressing that for height or impact over time. And then again, jump height should be comfortable but challenging. You want to make sure that people are maintaining their elasticity, and typically, don't even think about just going to like 10. If you see someone or yourself, you start to kind of like tinker out on your intensity and your power after like 8 reps, call it there. That's your set. Recover, 60 seconds, 90 seconds, 2 minutes in between, thinking of it as recovering from resistance training as well, because you're trying to generate power and reactivity. Don't treat these like block jumps in your CrossFit gym where you're doing them as a cardiovascular endurance activity. Like treat them like they are power and muscle generating activities. Recover between them. And allow yourself to, again, recover between days and training sessions, spread them out across the week. And again, if people have low training history, low fitness status, low experience like this, they might start with something as simple as just like stair steps or hard stair steps, rather than just jumping to hops or skips right away. You need to meet people where they're at, especially when we're thinking about people who might be in midlife and have never really done this stuff before. We're not just throwing them into the deep end here. And then again, as always, general weight bearing aerobic activity across the week is good. 30 to 60 minutes or more or less, whatever you can give, 3 to 5 days a week, making sure we're meeting those exercise guidelines, moderate to vigorous exercise in activity, either 150 minutes of moderate, 75 minutes of vigorous. Vary your activities, can work. Various activities can work, I should say. Walking, hiking, dancing, sports, whatever that looks like for you, running, jogging, skipping, whatever that is. are really important. They might not be, as potent for bone health as these other modes of training, but they are important for general health. They are going to be more helpful than nothing. We do see, improvements of people adapting physical activity in general, and these things improving. They're just not the impact size is not as great as the other things, but these are still very, very, very good things to do. And so, I love things if you're thinking about for the spine, squats, deadlifts, presses, rowing, things that are literally loading your spine. You can think of jumping, skipping, extension exercise that you're resisting forward flexion against it. But thinking about, again, load being on the spine, it's not bad for you. It's safe. Your spine is very resilient. And we want that for that stress, for that adaptation. And then hips, a lot of the stuff that's going to load the spine is also going to be kind of loading the hips because it's weight bearing on that. But you can also think about your things like lunges, step up, hips extensions, leg raises, step ups. We already said that. Split squats, things like that. And then again, jumping in multiple directions and or jumping in plyometric exercises and stuff like that can help here as well. And again, this is just like me giving you like general list of things that target this. This isn't like an evidence base of like, if you don't do this exercise, your bone won't improve. Like these are just me giving like, here's some exercises that might help with this as well. And so, when we're thinking about, individuals and who this is applied for, like make sure that you are emphasizing that if you're premenopausal or perimenopausal, adding this training in now, building and maintaining as much bone as possible. Recently, menopausal women, if you haven't been doing that as well, this is really, really important, sensitive time to start adding these in. And then late term, postmenopausal women, making sure that you are not just adding in stuff to protect bone health, but also continuing to add in training that supports fall prevention. So there is some good data as well on doing balance training or reactivity training or stability training as well for reducing fall prevention. But again, people who are resistance training and doing plyometric training across the board, like a lot of that is also going to support these things as well. Trying to aim to being athletic across your life is also a lot of this type of training that will reduce fall risk, fall prevention, and then hopefully with the conjunction of load bearing training and resistance training, you have stronger, sturdier bones, reduce fall risk, and there's less likely of having fractures or anything like that as well. And yeah, I gave you guys a lot of, potentially application of what this looks like and what this can look like for you guys as well, but making sure, that we are encouraging resistance training in this population. There's a lot of scary stuff out there about don't do this because it's going to spike your cortisol and make you fat. And don't do this because it's going to make you inflamed. And don't do this because it's going to make you bulky. And a lot of people in this age group and population have overall been not engaging in resistance training across their lifespan. And they realize, oh crap, I'm in menopause. I need to be doing this. Or women just don't realize how important this is until it becomes an issue later on in life. And bone is one of the most strongly associated to the menopause transition risk factors or rapid declines or increases that we do see. So it's really important that we are adding this into our training plans. This isn't menopause specific, but it is menopause important is a better way of framing that and thinking of that. And so, as always, working with a good coach, following a good training program, we would love to help you out with the Lyss method. We incorporate all of these things in our training programs. I call it hybrid on your terms because it's not just about, hybrid training, but it's designed to fit your fitness status and what you can fit into your life and where you're at and what you can and do. But if not, working with a good fitness professional and or coach or trainer or talking to a medical provider about better ways to support you are also important as well. So I think I touched on everything here in my outline. Hopefully because I use an outline, I talk slower. So everyone who complains about that, you're welcome. But if not, I guess my little cheeky reminder that there's a gear setting on YouTube, or you can change your podcast settings to slow me down otherwise on other forms of video. As well. But I think I touched on everything in my little outline here. So I hope that was really helpful for you guys. We kind of covered all that. I've been reading into this last few days, so I wanted to just make sure that I sat down and incorporated this into an episode while it was top of mind. But again, a lot of people have this message of like, women must lift heavy. And it's not that you must. It does work. It is powerful. It is beneficial. But you should lift moderate to heavy while pairing that with power landing plyometrics and your general daily activity. Unfortunately, once again, as always, menopausal exercise guidelines really just come down to these are things that were important for people to do across their whole lifespan. You weren't doing it. It becomes more important now. And it is really, really potent and powerful for prevention and maintenance of what we see with general aging or aging compound with menopause transition and or general stuff for women across the lifespan. So if you found this helpful, again, rate, review, like, subscribe, leave a comment on YouTube. Let me know. My friendly reminder that I love hearing from you guys from the DMs on Instagram. But if you enjoy these episodes, feel free to reach out and let me know. But make sure that you engage on either podcast or YouTube platform, because unfortunately those algorithms don't know that you appreciated it unless you kind of give them the nudge or signal. I get a lot of people who say, oh, I didn't know that I had to like support it there for it to know. It doesn't just push good content. And I wish that was true. I really do wish that was true, but it's not. So this is just like my friendly reminder that a lot of this female phys stuff, I don't really make anything off of promoting or sharing. It's just something that I do because I care about you guys and I want you guys to have good information. So, giving little nudges to the algorithm, sharing this with other people, liking, engaging, commenting, that stuff really does help me. And it's really, really appreciate it. And especially as I'm ramping back up the podcast, it means a lot. So thank you for being here. And until next time, I'm Lyss. I appreciate you being here. And thank you for tuning in to the Hybrid Lab.